Hello guys, welcome to our channel, PLAB.RECAPS. We are a channel that want to help doctors grow their careers, especially if you've decided to get into the UK. I am familiar with the process and want to share what I went through with you guys, and so this is what our first introduction video is going to be about. As you guys know that there isn't very many preparatory books available for the PLAB theory exam, at least not from the GMC themselves. So we want to help recap PLAB topics. The way in which we plan to do this is to create folders with different specialties, and then within those folders we aim to create a 15-minute summary of different topics within those specialties. Now, PLAB exam is not a specialty level exam or a postgraduate medical level exam, so the information that you need for these topics is not very specialty or consultant level information, as we will discuss in the future about what the exam really targets. You will get to know, and so these topic summaries are going to be just enough knowledge that you need to know in order to sit for the exam. People are at different stages in their life when they're giving this exam. Some may be well off into being registrars, while others are just in final year medical school, and then there may be some that are doing their internship. So really this is going to help all people to just quickly have a summary of each topic, and so that it can aid in them doing more of practice MCQs. Just want to talk a little bit about ourselves. So there are two of us creating this channel. My partner does the administrative and management work, and I myself have been through the PLAB exam, and I just want to share my journey with you and give you some tips and tricks as well. So hopefully you guys will find the channel helpful. I do request you to support our channel, and the best way to do this is to provide us some constructive criticism. We aren't really YouTubers, and we just want information to get out there. So let's begin with the process of getting into the UK. Now, almost all international medical graduates or IMGs have to go through the same process. So you give your IELTS exam, which is an English test, and then give PLAB 1, PLAB 2, and then get your GMC registration. What happens after GMC registration really depends on how much level of training you've already had. Have you already completed your internship or not? So these are the kinds of things we will discuss with you later. Now, the journey from IELTS to GMC registration takes around 1 to 1.5 years. This is if you haven't had to resit any of the exams. So do plan ahead, and hopefully we can give you some tips regarding this as well. There has been mention of the fact that PLAB will be replaced by the UK medical licensing exam in 2022. We don't know much about this, especially now because the pandemic has unfortunately hit us. So we don't exactly know what the situation is with when they're going to be when the transition period is going to be and what it's going to be like. The UKMLA will have two um, stages, which is the applied knowledge test and then the CPSA. Now, to me, it sounds like the same exam, but just with a different name. But of course, I can be wrong. We can't really talk about it unless we have some information. This exam is going to be so currently in the UK, the UK graduates don't have to give PLAB, but this is going to be an exam which will be both for UK and international medical graduates. So when we do receive updates about the exam, we will let you know. So let's begin. So just a few basic things that you need to do before we get into the whole PLAB process is that join Facebook groups on PLAB 1 and PLAB 2. These are really helpful, not so much because you can gain some real knowledge, but it's more so for discussions. As you go through the process, you will realize that there are other people out there who are in your similar situation, similar position, and you can have discussions about visas and accommodation and things like that, which course you like, which course is better, and things like that. So it is really healthy to join these groups. If you don't have a Facebook account, if you're like me and don't have one, just create a temporary one, and just till you get through the PLAB exam. The first step is to create a GMC online account. I will leave a link down below. Um, the reason being that you will book all your exams through this account. You will get your results here. You'll also apply for your GMC registration through this account, and literally most of the process of getting into the UK does happen through this account. So that should be your first step. Okay, guys, so let's talk about IELTS. Even though we're not an English language course, we thought we would include it because it is part of the requirement, and I thought I could give people some tips. So, as you guys know, the IELTS exam is an English language requirement. Um, now, IELTS itself has many different types of exams. Generally, they cater towards getting a visa in the West, and so they are basic English language exams. But the exam that you guys need to sit for is the academic IELTS, which is different to the rest of the exams. It is specific for those who want to sit for PLAB. It's a bit of a more rigorous exam. The reason I'm stating this, though it may be obvious to some, is that in the past people have taken the wrong exam, and so guys, save yourself some time and book the correct exam. Now the score required is an overall 7.5 with 7.0 in each area of testing, which means that you cannot score less than 7 in any of the sections and then try to compensate in another section and get an overall 7.5. The deal is that you get an overall 7.5 with 7 in each area of testing. The exam is around 3 hours long, and the validity is only for 2 years. So even though your English won't expire, unfortunately the certificate will. You have to keep this in mind because GMC requires you to have a valid IELTS certificate on the day of your GMC registration, which means that you have to pass your PLAB and apply for GMC registration within 2 years of getting your IELTS certificate. Which so basically, if you have crossed 2 years, you will probably have to sit for the exam again. you can apply for, you can book your IELTS exam from their website. Now let's talk about preparation. I personally did attend a course. It was a 2 or 3 day course, but honestly, guys, you do not need a course. You absolutely do not need a course. They cannot teach you English over a course of 2 or 3 days. So don't waste your money in trying to trying to get through a course. Just buy the latest book on academic IELTS. It generally comes with a CD. Visit the IELTS website to know the duration of each area of testing, and then just practice, 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 practice with a timer on your own. The two sections that people mostly do badly is the reading and writing sections. It's not so much to do with the difficulty level, but it's more to do with time management. People spend just too much time on the reading section, and so by the time they get to the writing section, they do not have enough time to compile their thoughts and get it on paper, and sometimes they do not finish the writing section. So my tip to you is the answers of the reading section is in the order of the passage. So don't try to thoroughly read the passage. Just skim through the passage and try to locate for the answers in the order of the passage. So the answer to the first question will be generally somewhere in the first paragraph. The answer of the second question will be either at the end of the first paragraph or in the second paragraph, and so on and so forth. And this tip may be helpful. Just make sure that you finish your reading within the time allotted for that section, so that you have enough time for writing. And when you do your writing part, make sure you have a good design, in the sense you have a nice introduction, a good body, and a final paragraph that summarizes the whatever topic you're talking about, and then and most probably you should be fine. So let's move on to the theory exam of PLAB. The prerequisites for the exam is to have an accepted primary medical qualification and the result of the academic IELTS exam. If you are in your final year of medical school, then I would suggest that you book your IELTS exam probably after your final year exams, so that by the time you do get your primary medical qualification, uh, in other words, by the time you do graduate, you would directly become eligible to sit for your PLAB Part 1 exam. Now, the knowledge tested in Part 1 is that of someone who has completed 1 year of internship or house job, which is equivalent to a UK trainee who is entering their foundation year 2. So in the UK, internship is generally internship or house job, whatever you'd like to call it, is for 2 years. Here they call it a foundation program. So FY1 is a foundation year 1 trainee, and FY2 is a foundation year 2 trainee. So the exam is basically targeted as if someone has completed their first year of internship or house job. Now, the score required, there is no cutoff. The passing mark is different for different exam, for each exam that takes place in the year. It is decided according to the international performance. There is no negative marking. There's around 180 MCQs, and the exam is run around 4 times a year. The validity is only for 2 years, and you can resit it 4 times, with an exception of a fifth if you kind of provide further evidence that you are able to sit for the 5th time. Now, coming to the preparation, there is absolutely no need for a course. I don't know if there are any out there, but if there are, there's no need for a course. Just subscribe 2 and MCQ bank online. There are many available. The one that I used was the past medicine one. So it has timed mocks. It has timed mocks, and as well as it informs you about your performance on individual questions, the difficulty level of each question, so you get an idea about where you're falling in these in trying to answer these questions. And then it also gives you a summary about the topic. So I found these the summary is sometimes not entirely adequate, but I did find overall that this was very helpful. So practice MCQs, practice MCQs, and practice MCQs, and you guys will be fine. I also, these banks generally, they have different packages, so just calculate the time you have left between now and your exam and subscribe to the bank accordingly. Past medicine wasn't very expensive. I do not remember exactly, but it was around I think £6 for I think 3 months or something like that. I'm sorry, I don't completely remember. Um, but just look out for that, and book or subscribe for your pack accordingly. Um, Now, this is the area where we think we can play a role by providing a bit more detailed summary, which should be enough to cover for that particular topic. So guys, again, if you are finding this presentation till now helpful, kindly support us by providing us with constructive feedback, and leave your comments below. So now coming to the part 2 of the exam. Um, so the prerequisite is simply PLAB part 1. Once you get your result, kindly book for your part 2 exam. Do remember that the seats go off quite quickly, so book the exam as soon as possible. Now, this is basically it is a clinical exam with around 16 scenarios, each lasting 8 minutes long. It will include history taking, examination procedures, management of acute settings, BLS, dealing with difficult patients, ethical scenarios, counseling stations, breaking bad news stations, interpretation of investigations, interpersonal and communication assessments. The total time for the exam is around 3 hours. You will get like 1.5 minutes between the scenarios to read the instructions outside before you enter. And those instructions will include patient information. And there are also 2 rest stations where you will take a short break before you move on to your next station. So as you can tell, these this kind of exam is basically uh, basically scenarios that one is expected to encounter while you're doing your first year of internship. So if you are in your internship, or if you have completed your internship, so you will be well aware of these situations, and it will be quite helpful to have done an internship. Now, if you're in your final final year in medical school, then it will be good if you are able to start an internship in your home country and prepare for part 2. Um, the validity of this exam is just 2 years, and you can resit it 4 times. Now, regarding preparation, I would suggest that you attend a course for this in the UK. You can apply for a standard UK visitor visa for PLAB 2, which allows for a stay of less than 6 months. Plan your course to be around the time of the PLAB 2 exam and allow yourself to have at least 1 week before your exam where you can do a clinical mock after finishing the course. Now, now the GMC themselves do not recommend that one does a course, but I do feel from experience and going through analysis of this exam that it does help people familiarize, like it helps familiarize the candidates with the UK patient-doctor culture, also the testing environment, procedures, practicing the scenarios that may come in the exam. It aids with communication skills and becoming more mindful of not coming across too harsh or abrupt. Which type of course to attend is something again you can discuss on the Facebook forums, and you may get an idea about this. There is no fixed pass mark. It varies according to the difficulty of the station, and for each exam, the pass mark for each of the stations in the exams are added. Then there's one standard of error of measurement taken, and this creates the total score for the exam. You must meet or exceed the total score and pass a minimum of 10 stations starting in December 2020 to achieve an overall pass. One tip that I would like to give is that whilst you're preparing for PLAB 1 or PLAB 2, do go through the good medical practice guidelines that is available on the GMC website. If you don't have time to go through the entire guideline because it is quite long, do go through the case scenarios. The reason I'm saying this is because it kind of makes you aware of some ethical dilemmas that you can come across, and even if it doesn't help you so much in your theory exam, it may help you in your clinical and more so for any job interview that you would give in the UK. So scenarios such as, what do you do if your consultant comes to work drunk, or you ask your junior to um, uh, to uh, to take bloods and of a patient that required urgent attention, and he or she did not do it. What will your approach be? So that situations which are difficult to handle, like a patient has been diagnosed with epilepsy and has been started on medication. You have asked her to report to the DVLA regarding this so that she stops driving, but she does not report it. So what do you do in this situation? So these are tough situations, and if you can just go through the case scenarios and the relevant guidelines for those case scenarios, it will be something that will really benefit you. I will leave a link down below to give you an idea about what, like, the link will be to a video which will show you what you can expect on the PLAB day, and hopefully you will get familiarized with the uh, exam day. Now coming to GMC registration, so as I stated before, the foundation year program is for 2 years in the UK. Most people around the world do 1 year of internship or house job. GMC register is basically a medical register. It shows what type of registration doctors hold. There are 4 types of registrations. There's either your provisional registration, full registration, specialist, and then GP. Now, people who come to the UK are in varying situations. For example, some of them have finished their medical school and they got married and they had to directly come to the UK, so they weren't really able to do any internship as such. So for them, it will be advisable to get a provisional registration and then apply for a foundation year training program, um, and then start working in the UK. But then there are others who have already finished their internship or have even done a postgraduate medical degree. In this case, they can apply for full registration with a license to practice. Um, in case you are of those who have finished 1 year of internship, you can apply for full registration with a license to practice and then come to the UK, work around 6 months to 12 months in a non-trainee post and get an equivalency certificate. As I stated, internship in this country is for 2 years, so you would have to do 1 more year, get an equivalency set, not necessarily in a training post, but you can also do it in a non-training post, get an equivalency certificate for the year 2, and you will then directly become eligible to sit for you will directly become eligible to get into a specialty training program. Okay guys, so I will leave a link down below where you can check out the different types of registrations. Collect all the documents that you need for your GMC registration while you are sitting for your PLAB.1, PLAB.2 exams, because this would be really helpful to you once you come to the stage of GMC registration. You would just have to, you won't have to hassle yourself for collecting everything. You would have everything ready to attach onto your GMC online account. And before I wrap up, I'd just like to talk about this picture. I feel like, so here you can see a couple of birds um, looking for food, some already feeding, and I feel like we are these flock of birds. We have the same aspirations. We have the same desires. We have the same. We are all looking for the same opportunities, and we all have to go through the same process. And so we should try and support each other. Unfortunately, in medicine, sometimes it can get a bit too competitive, and sometimes that competition is unhealthy. But I feel that we should we should instead support each other and help each other to get through this, and hopefully we will get through this. During this process, you may come across people either on the forum or in person who may be a little pessimistic or have had different challenges, and so they may not be as encouraging. I would request you to not pay very much attention, because please remember that everyone's challenges are different and everyone's way of dealing with success and failure is also very different. So always stay positive, and we can do this. We can achieve this together, and we will be fine. If you found this presentation helpful, please, once again, do leave your comments and provide us with some constructive feedback. We would really appreciate it. Thank you.